Veterinary governing bodies now taking away your freedoms. In many places, it's now illegal for you to see a non-veterinary animal health practitioner, such as a chiropractor, Chinese medicine practitioner, homeopath, even a non-veterinarian animal dentist. What do you think of this? Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. I was recently talking to a local pet parent who was saying that they're very invested. They want to use alternative veterinary medicine for their dog and cat, but they can't. Where I live in British Columbia, Canada, the Veterinary Act, it prohibits non-veterinary animal health practitioners from treating or seeing any animal unless they're under the direct supervision of a veterinarian. Referral by a veterinarian to a non-veterinary health practitioner, that's illegal. That seems okay, right? Just have an alternative practitioner working in a clinic. But the big problem here is that many veterinarians, they don't want to have the legal liability risk of having to supervise a non-veterinary animal health practitioner. What if something goes wrong? They're liable. Surprisingly, there's a really big list of unauthorized veterinary practices. Massage and Reiki, acupuncture, physiotherapy, chiropractic, Tellington T-touch, even behavioral training. TCM, traditional Chinese medicine, dentistry, homeopathy, herbal medicine, nutraceutical medicine, craniosacral therapy. Violators such as the veterinarians might refer to some of these practitioners. They're putting themselves and their practice at serious risk. Lengthy proceedings, big fines, potentially may even lose the ability to practice. And if you happen to be a practitioner of one of those therapies, i.e. a non-veterinary animal dentist, you're risking serious fines, serious legal action against you. This has really decreased access to many non-veterinary animal therapies, and there is a whole bunch of people not really happy with this. It seems to me that they're trying to just put all of the control in the hands of the veterinarians. They're saying that veterinarians, they know it all. Yes, we can do conventional medicine, do surgery, but also we can do a bunch of alternative stuff. Chiropractic, traditional Chinese medicine. How about craniosacral therapy? It's a one-stop shop, just kind of like the superstore. But there are many skilled complementary practitioners. They spend years going to school, honing their craft. In my opinion, they're so much better suited to be treating your dog or cat with acupuncture needles versus a veterinarian who takes a 2-week acupuncture course. If I've learned anything in my years, there's no way you can know it all. Yes, in many cases, conventional treatment, that's effective, that's a good option. But not always. And there's so many other conditions, many of these chronic ongoing conditions, autoimmune diseases, etc., where pet parents, these dogs and cats, can really benefit from alternative care. But you, as a pet parent, you're unable to get that. How about even just some of the costs now or the difficulties accessing veterinary care? Especially since COVID, there's been such a big demand for veterinary care, and we've seen veterinary fees just skyrocket to the point where it's not unusual to go get a simple dental scale and polish, a couple incisors extracted. You're looking at a bill exceeding $1,000. Many people can't afford that. So would it not be a better option to have a non-veterinary animal dentist treat that animal? Apparently the veterinary associations, they think no. I just don't understand, how is it better off if that animal is just running around with teeth that are more rapidly decaying, progressive gingivitis, there's risks of things like septicemia, heart disease, etc. Whereas imagine you just have someone who goes in and removes the bulk of that plaque and tartar. But apparently that's not a good idea. Not sure why. Obviously, you don't want Buddy from your garage fixing your dog's broken leg. I get that. Veterinary medicine, that's what it is. That's like assessing an animal that is injured, that's being trained in providing adequate anesthesia, that's having AHTs that can successfully monitor that animal, then having a skilled veterinarian who has learned how to properly do orthopedic surgery and repair that fractured leg. But that's not what we're talking about. For instance, you've got an animal that just hasn't been the same, been chronically sick since their last vaccine. In many cases, some of these skilled practitioners, i.e. a skilled homeopath, can properly assess that animal and give you specific homeopathics that could potentially help your animal. But you're not allowed to do that. This is such a big problem in the area where I live. A group has actually formed an association called the BC Animal Owners Association. So many people are animals, they have really benefited from non-veterinary animal care, and they want that to be able to continue. They want to have the right to choose. I think that's completely fair. Part of the veterinary oath is to relieve animal suffering. Part of the mandate of these veterinary colleges is to protect the public. But are you really protecting every animal? If you've got pet parents, they can't even access veterinary care because they can't afford to see the vet. There's no way they can pay for that veterinary dentistry. Or you think your dog could benefit from acupuncture, but you don't want your vet who went to a weekend course to start sticking needles into your dog. You want someone who's gone to school for years and years and years and learned how to properly put in acupuncture needles? Makes complete sense to me, yet apparently not according to the veterinary associations. Their objective is to create a place in the law where non-veterinary practices, they're considered outside the scope of veterinary medicine. If you're in BC and you want to know more about this association and support them, I'll put a link in the description box. But it kind of does feel like this big brother thing, where you've got this big governing body, this government-related group that is saying, we know what's best for you, we know what's best for your dog, your cat, your other animals, and this is what you're going to have to do. It really does not seem right. Ultimately, it should be your choice of how you feel is best to care for your dog or cat, not having them tell you what you can or can't do. But as you're watching this channel, you probably know that yes, you can learn about alternative home remedies, herbs, homeopathy, acupressure, massage, many of the exact things that I discuss on the channel, and you can implement those with your dog, with your cat. The one thing they can't do is regulate what happens in your house. For now. Thanks so much for watching this edition of Veterinary Secrets. I'd love to hear your feedback, love to hear exactly what you think.